I'm here, we are part of what's called the complex pain team, and I'm here with my colleagues Ethel and Steve, and I'm Nick, and I'm going to kick off this little talk about, can we have the next slide please? Pain! Anyone here ever experienced any pain? Yeah, not good. So what we're planning on doing today is giving you a general overview of pain, and we're going to concentrate on persistent pain, chronic pain. And I'm afraid what we can't do today is to get into consultation type discussions about individual people's problems with pain and the medications that they personally are taking. So we'll have a general conversation about pain. So, what's the house got to do with pain, I wonder? Has anyone got any ideas about what pain might be for? We all know it's horrible, but do you think it's got a purpose? An alert system, a warning, absolutely right. So here we are, nice and comfortable at home, living our lives, everything's hunky-dory, we're comfortable sitting on the sofa, but someone's trying to break in. There's potential for harm. And how do we know that someone's trying to break in? Because there's a burglar alarm. Yeah, the burglar alarm lets us know that someone's breaking in. So in this picture, pain is like the burglar alarm. You're absolutely right, it's a warning. It alerts us to a threat of potential harm. Yeah, it's ringing away. And that warning can be very useful. If you've just trodden on a nail that's gone into your foot, it's useful to have a sensation that tells you need to do something about it. If you've just had a fall and bruised yourself badly, or even broken an arm perhaps, or a wrist, pain is useful. A, it tells you probably need to go to the doctors or A&E to get it looked at, and B, it helps stop you from moving it around and causing more harm. So it's really useful. Oh, and he's off. Now, sometimes you can have that injury which gives you the alert and causes the pain. Or you might have had an operation which causes pain in the short term. But sometimes the alarm doesn't stop ringing. And in those situations, although all the healing's taken place, the pain persists and you end up with a chronic pain situation. So the problem here is it's the alarm system rather than what's happening specifically in the body. Does that make sense?
Yes.
Yeah? Okay, good. And it kind of partly explains the difference between what we call acute and chronic pain. Acute pain is pain that comes on suddenly, perhaps an injury or after an operation. It's usually pretty easily treated, actually. We've got painkillers that can treat it. Won't take the pain away completely, but makes life livable with that pain while the healing takes place. It's a useful response and serves to protect us from injury. But chronic pain, on the other hand, is this pain where the alarm, the burglar alarm, is still ringing. All the healing's taken place, but the alarm's still going on. And it's not useful, particularly as it's designed to make us listen to it, isn't it, pain? When we've got pain, we want to pay attention to it. And sometimes we feel like there must be something wrong. And we go to the doctor and say, "Doctor, I've got this terrible pain. I've had it for months and months and months and months." And they send you for a scan. And there's nothing on the scan to explain the cause of the pain. And you can end up feeling like the doctor's telling you it's all in your head or there's nothing wrong with you. Well, there is something wrong with you, and that is the pain processing system has become oversensitized and the alarm continues to ring. So when we're managing chronic pain, we think of all the different components, things that can help with chronic pain. And we've got this pyramid of things that we can do and different approaches to managing chronic pain. And like any pyramid, what's really important is to get a good firm foundation to build on. And it's probably true to say that the first three blocks here, lifestyle, physical activity, mind-body techniques, they're the mainstay of the work that we do with people who live with persistent pain. Medication can have a role, but they're often a bit limited. And there are sometimes medical interventions that might help, perhaps an operation, or perhaps an injection into the spine or around a nerve to deaden the pain. But they're not always terribly effective. These bottom three things are. Now, before I hand over to my colleagues, I'm just going to say a bit about medications. And I want to just say a few things about over-the-counter painkillers, in other words, rather than stuff that your GP might have given you, special painkillers, things like amitriptyline or gabapentin or pregabalin or duloxetine. There's a whole range of them. They are dealt with separately, and you need to have a conversation with your GP if you've been suggested that you take them. But what you can take from over-the-counter is our favourite in the pain world, because the side effects are really rare. Most people can take it without getting horrible side effects. It's very safe if you keep within the recommended doses. So if you weigh 8 stone or more, you can have 2 tablets up to 4 times a day. If you're less than 8 stone, 1 tablet 4 times a day. And if pain is bothersome, it's best taken regularly to stay ahead of the game, rather than taking it because the pain has come. You're always trying to catch up then. Another type of over-the-counter painkiller you may have come across, ibuprofen, or Nurofen it's sometimes called, and aspirin. They're actually in the same family and they work in a very similar manner. But they've got quite a lot of side effects, and this begins to make them a bit problematic sometimes. So the common ones are irritation of the lining of the stomach. So when you take it, you might get some pain here and possibly some acid coming up. It may progress and actually cause an ulcer in the stomach, a gastric ulcer. People who have asthma, that can sometimes make them wheezy and cause an asthma attack. For susceptible individuals, they can damage the kidney if they're taken for any length of time. And they also thin the blood. And of course, I bet there are some people in the room here who take aspirin to thin the blood as it is, 75 milligrams given by the GP. The thing is, the pain-killing dose of aspirin is 300 milligrams. 75 milligrams once a day to thin the blood, that's fine. 300 milligrams is the pain-killing dose, which means that you're much more likely to get a range of these side effects. And I guess that if aspirin were invented today, it wouldn't be allowed to be bought over the counter. I think it would probably be a prescription-only medicine. And then the other group is of over-the-counter painkillers are the weak opioids. These are all in the morphine family, and common ones are codeine and dihydrocodeine. When people take them, it often makes them feel woozy or dizzy or over-sleepy. Most people get constipated on them. Some people feel sick. And if you take them for any length of time, you can become dependent on them. So they're not without problems. They're often combined with paracetamol as things like solpadeine or cocodamol or didromol. You may have heard of those drugs. And if you have them, you need to be really careful about not taking too much paracetamol because it's already in that drug. And I'm coming back to paracetamol. So if pain is bothersome, or you've got a day when you really want to do something and pain's getting in the way, perhaps you wanted to meet your friend for lunch, or it's your niece's wedding, whatever it is, the day before and the day of the wedding or the meeting, take it 4 times a day so that it has a good chance to work, and then pain won't intrude on your day out quite so much. Okay, so I'll gladly pick up on questions later. I'm gonna hand over to Steve now.
Thanks, Nick. Hi everyone, I'm a psychologist in the pain team. I thought it was probably important to just talk a bit about how common chronic pain is. It affects probably a lot more people than you might realise. So around 8 million adults report chronic pain, so that's any sort of pain that persists beyond 3 to 6 months. And often the people that we see have had pain for sort of 5, 10, even 20 years, to a level where it's really quite high, so it disables people, so it gets in the way of living day-to-day life. And I can see people nodding who might recognise that kind of feeling. And this was published by the British Pain Society, and the same report said that around 43% of adults, so around 28 million people, currently live with some degree of chronic pain in the UK. And you might think we've come here to talk to you because you're a group of mostly adults over about 40, older adults, and so doesn't pain just get worse as you get older? That's not always the case. We can see here that chronic pain affects lots and lots of people from a very young age. So adults 18 to 39-year-olds, about 30% of young adults have some degree of chronic pain. Is that something that people realise, or would you know that? Yeah. It's not always obvious though, is it? Because you can't see pain. So actually that can be quite a surprising statistic, that a third of young people might have chronic pain. And of course this does get more common as people get older. So over the age of 75 years, this report showed that around 60%, just over 60% of people, some level of chronic pain. So of course, living with something like pain does affect people in lots of different ways. It's not just about the feeling, the sensation of pain and how much that hurts and where it hurts. It has an impact, doesn't it? So this really, really messy drawing here is something that was taken from a group, a pain management program that's run at the Pain Management Centre where we have connections with. And we asked people, how does pain affect your life? So you've been living with pain for months or years, how does it affect your life? And these are some of the things that came up. You probably can't see them from where you are, but let's just have a quick look through. Frustration, low mood, feeling stuck, fear. Often people are quite afraid of more pain getting worse. If I do this, if I do that, my pain will get worse. Not being able to plan, difficulty communication with friends and family, poor sleep, difficulty using public transport, quite difficult interactions with medical healthcare professionals as well, who aren't always able to help with chronic pain through medication. So lots and lots of things. If we move on to the next slide. This is, I think, important just to recognise, because if we're saying that 40% of the general population have chronic pain, it means that there'll be people in this room today that do have some degree of chronic pain. So it's important to recognise that impact of pain is really normal, really common, that it affects things like mood. So chronic pain can have an impact on people such that they might feel depressed, might have lots of anxiety because they're worried about effects on job, effects on housing, relationships, even effects on being able to go to the shop to do shopping, and maybe things like playing with grandchildren as well, which might be relevant for some of you here, that how pain might get in the way of that sometimes. There is an opposite effect as well, where things like low mood, stress, anxiety are really well known to increase pain. So if you're already in pain and you're struggling, and then it causes more stress and anxiety, you can see how it can develop into a really difficult cycle where people get really stuck. And it's quite hard to get out of it. If you imagine having pain, even an acute pain, let's say you've fractured your leg, how you might feel in that period, or you've maybe broken your hip or been in hospital. Lots of pain, and then what happens? There's a period of rehab and rehabilitation, isn't there? And think about, if you've been through that experience, how that makes you, how that felt at the time. So you've come out of an operation, should be getting better, but actually you're not. You're stuck at home, you can't move. You might be on your own. And some of the feelings that come up there, some of the worry around that, some of the anxiety, low mood, but actually one thing that's helpful there is this is going to pass, I'm going to get through this. And maybe 3 or 6 months down the line, you're back to where you were. With chronic pain, that period doesn't come, so people get stuck in that moment of feeling stuck. And so you might start avoiding things that are important to you. Maybe, obviously, avoiding activity. If I do activity, what if that causes more pain? So then that affects your physical function as well, your muscles, your stamina. And if you're not doing things that you enjoy, avoiding seeing family, friends, going to the movies, whatever it is that's important to you, what happens to mood? That can drop, and then pain goes up. So you can see how people get really stuck. The important thing is that, although we're talking about the effect of mood on pain, it doesn't mean it's in your head. It just means that you've got pain, and having low mood can make it worse. Just go back. So in terms of, I suppose I'm giving you lots of problems here. There's some resources at the end that you can go to look at for ideas and ways to start to break out of this cycle. But if you think about the problems here, well, some of the things that you can do are quite common things these days, like meditation and mindfulness. That can help to calm the nervous system down and the autonomic nervous system, so that can reduce the effects of stress and anxiety on the pain system. Keep connecting with people. You might have pain. What happens if you don't see people and stay in the same place? Does the pain go away? So one argument is to keep doing things that matter to you, but doing it in a mindful way, doing it in a way that doesn't always flare your pain up, but knowing that if you socialise, if you connect with people, if you see the grandchildren, it might not be the way that you want to do it, you might not be able to pick them up, but you're seeing them. So it's important to keep doing that, because that feeds back into this system. And then things like, if you do have chronic pain, think about what you can't do, think about what I can do today with the pain. There's also professional help through your GP, who can refer you to places like the psychological therapy services that are available locally. They can help with dealing with some of the fallout, that secondary pain and suffering that comes with a long-term condition. And of course, you can ask to be referred to pain management centres like the one that we are connected with, and there'll be information on that at the end. Pass over to Ethel, physiotherapist in the team.
Thanks, Steve. Right, so activity, exercise, whatever we want to call it, that always causes a lot of worry. Some people are told, rest up, and other people are told, you're not moving enough. And often there's this dilemma. I know that if I do something in particular, say the weekly shop, I know there's going to be a fallout from that. I know that I'm going to be laid low maybe for a couple of hours, maybe for the next day. And all these choices make thinking about joyful activity and valued activity, things that you really enjoy, quite difficult. So it is very important to experiment with your body. What pain tends to do, what long-term pain tends to do, is take away the comfort and the confidence that we have in our body. Slowly we do less and less and less. The less we do, the stiffer our muscles become, the weaker our muscles become, the stiffer our joints become. So when we come to move again, then it becomes more difficult, which is why we're always harping on about how important it is to keep moving. And no movement is too small. So we're not talking burpees, star jumps, walks around the park necessarily. If that is what you want to do, fantastic. Maybe not the burpees, but making sure that you keep moving is really, really, really important. And I'm wondering if this is familiar to anybody. Good and bad days? Do people here have good and bad days? Yeah? And maybe you started off with one bad day, maybe once a month, and before you know it, you've got every other day that's a bad day. What happens on the good day?
You do too much.
You do too much. You want to catch up. You want to make sure that this good day, you're ticking off that mental list that you have of things that need to be done. You also don't know how long that good day is going to last. You're thinking of it as a good day, but it might be a good 3 hours. You want to cram as much as you possibly can. What happens when you cram all that? The pain tends to get worse. So if we look at this little cycle, we're having a good day, we try to catch up, we try to feel normal. It's all because we want to feel normal, and there are these thoughts that go through our head like, I should be able to do this, or I used to be able to do this, or I need to do this, or I must do this, rather than I could do this, which is what we'll get to in a minute. We tend to overdo it. Because let's face it, once you start something, who wants to stop halfway through, yeah? So we push, even though our body's saying, actually, you should probably take a seat now and just rest for a little while. And in your head, you're thinking, oh, I've only got 2 minutes left of this. But by the time you're thinking it's only 2 minutes, that will probably turn into 10 minutes because your body's already quite tired at that point. It's giving you a sign that you need to do something to change. Change doesn't necessarily mean you stop doing what you're doing, but change might mean changing the position of what you're doing. So if, for example, if you're making a meal, and let's face it, most of us would make a meal standing, especially if you have a small kitchen and all that kind of stuff. But perhaps think about, before you start, how you're going to plan that out. You're going to say, I'm going to peel the veg sitting at the table, and then I'll stand to add the water into the pot. So you're using your body differently to your advantage to still be able to do what you want to do, despite the pain. Because what tends to happen is that increased pain then has the impact on mood, just as Steve was saying. We feel very low, and we might be thinking, how much my life has changed. I don't want to be like this. Older before I want to be old. You know, all that kind of self-talk can be quite unhelpful, which then lowers our mood quite a bit. And then what happens? The next good day comes along, and off I go again. I do it all over again. And the more I do that, I might notice that I get flare-ups more frequently, and what I'm able to do gets smaller and smaller and smaller. Right? And that is why we encourage activity so much and thinking before we do things, because it's so important to make sure that people remain connected to what they need to do, to what they want to do, but more importantly, the activities that give them joy, happiness. Because if you're constantly going through the cycle, what tends to happen is that all you end up doing is the things you must do, and there's nothing left for the things that you enjoy, which then makes life quite black and white, doesn't it? Doesn't make it very colourful. So those are some of the things that we would like people to start thinking about. So, how do we plan? I know this sounds very annoying, that you cannot be spontaneous, that you need to plan for successful activity. We want people to succeed, and the way people succeed in getting a handle over their pain, but also doing what they want to do, is by planning. Initially, you have to plan. Perhaps in a pre-pain life, you could have done 4 or 5 tasks. You could have washed the house from top to bottom and done the hoovering and done the laundry. But things have changed. I always encourage people to think about, in a way, what is the worst that could happen if this particular task is not done today, right? And this might be because we've had a lifetime of having a certain routine. Routine goes out of the window with long-term pain, and it's about finding that new routine that works out for you. It's also about choosing activities that you enjoy. So, for example, being a physio, I've had my fair share of telling people to do very annoying exercises that are quite boring, yeah? As I've worked a little bit longer, I've figured out that doesn't work for everybody. Very few people like the 10 repetitions 3 times a day. Finding things that you really enjoy, applying yourself to what you want to do, be it gardening, be it bird watching, sitting in a park with an ice cream, whatever that is, that is still activity, that is still movement. It's also about thinking that pain might or might not change with exercise or activity, whatever that is. So having a temporary increase in pain after a new activity, or if you're doing something that you haven't done in a while, that's normal. What is not normal and not helpful is if you're in flare-up for 3 days after whatever it is. Yeah? That is not normal. That would mean that you should probably go back to basics and figure out what could I do differently. We've also been told to touch very briefly on nutrition. There's a lot of information that's coming out about the importance of nutrition. We've only put a very, very simple summary here. But if you want more information, I would highly recommend this website, the Live Well with Pain website. There's lots of information there and reasons as to why. For example, why do we need more fruit and veg? Why do we need more omega trees? Why should we stay hydrated? So we know that if people are dehydrated, their pain levels go up. Yeah? So all of these things are really, really important. Now, it doesn't have to be any fanciful food. Go back to basics. Avoid as much as possible ultra-processed foods, but also make sure that you eat regularly. Your body's like a machine. It needs fuel. If it's not having fuel, it's going to struggle. If you have issues with meal prep, with maybe shopping, there is help out there that you can get referred to. Yeah, so health and social care assessments are there to help with that sort of thing. Reaching out to Age UK and asking about help, all that sort of thing. They can signpost you. But it's so important that your nutrition is on top, really, just to help that body keep on ticking away. Last but not least, the reality is that you can do everything well. You can have a really good phase and you can feel like you got on top of things quite well, and you still have a flare-up or a setback. Yeah? Isn't that part of life? Is everybody's life smooth sailing? No, neither is life with pain. So there will be setbacks. The important thing is not to let that setback your confidence, right? You've had setbacks before, you've had flare-ups before. They're not forever. It's almost like you're weathering a storm. You've got no control over how bad the storm's going to be. And sometimes all you can do is just wait it out. We see a lot of that, don't we? Because people get very worried if their setbacks are a little bit longer than they would expect. We're not saying don't seek help, right? So you are the experts of your body, and be confident enough to actually say, this is not like my normal pain. It's more, it's different, right? But the reality is that flare-ups are unfortunately part of the game. Can I have the next slide? Right, so just to put it all in summary, what we've all been talking about, this is essentially the recipe that we would suggest. So it's looking after our mental health, making sure that we keep connected with people, connecting to the things that we enjoy, moving as much as we can within our limits and sensibly. It's better doing a little and often rather than a big bout of activity that then lays you flat for a week. Thinking about your sleep. Very, very important. And the Sleep Charity has a lot of information about how to improve sleep and why sleep gets disrupted. Nutrition, as we've already said. And last but not least, having a plan for when things don't keep on track. That plan can be very important because when you are in the middle of a flare-up, the last thing you want to do is remember what helped last time. You probably don't have the space for that. So having it written some way, this is what I normally do, then that could help that flare-up be navigated a bit easier.
You'll notice there's no medications on this slide, yeah? Because at best, medications might help you to do these things, but this is the important stuff for people who live with pain. Okay, thanks.
So here are the resources that Steve has put together. So obviously the first port of call is your GP. The reason why we say that is we know that there are a lot of people with undiagnosed long-term pain. Seek the help that you need. Seek help when things feel different. If you already have been told that, say you've got, widespread pain, fibromyalgia, that doesn't mean that you're not allowed to have anything new happen to you, right? So have a really good think. Is this my normal pain or is this something different? And have the confidence to seek help. As Steve said, there are lots of pain services at different levels. Yeah, so you've got your Camden MSK pain service, and you've also got the pain center in Cleveland Street, just by the BT Tower. That's where we camp out every now and then. Your GP will be able to explore your options with you at that point. If you're thinking, it would be really good to speak to somebody, this is really getting me down, I'm really frustrated that I can't do what I want to do, then perhaps having some counselling might be helpful. Again, it's not because you are exaggerating it or making it up or it's imaginary, whatever it is. It's because living with pain is hard. It changes life. And it's important to get that support. And if, hang on. If you have access to the internet, these would be the main websites that we would recommend in terms of good, sensible information that is also quite achievable. It's not fancy. And pain management, really, the basics, are not fancy at all. It's about rethinking things and changing our mindset. So the pain toolkit, the Live Well with Pain, mine of information over there, and the Flippin' Pain. Last but not least, you have something on your doorstep that can be really helpful. I had a quick look at the AGK's Islington website. There's lots of stuff I would like to do, actually. So there are lots of things that you can join in to build connection, but also to get you moving. There's a whole variety of stuff, from seated exercises to painting to lots of things. It doesn't have to be about pain. Sometimes actually being in a situation where people don't talk about pain is actually quite nice. But it's also quite nice to be in a situation where if you're having a bad day and you're sitting at a table having a coffee with somebody and you say to them, I'm having a bad day, they understand what a bad day is. And you don't have to explain yourself too much. Yeah? So this website is a really good resource. We would highly encourage you to have a look at it and ask about what's out there available for you. Thank you.
Thank you.